Hi there, I'm Alex from the Medical News Bulletin, bringing you the biggest medical news of the week. Visit our website, www.medicalnewsbulletin.com, for daily updates. You can find the link at the bottom of the screen. Today, we will be talking about the benefits of vitamin D, the link between fruit and heart health, how telemonitoring can help diabetics, the link between temperature and preterm birth, and hemophilia's impact on quality of life. So let's get started. Sitting in the sun, taking a Flintstones multivitamin, even eating tuna, they can all help boost your vitamin D levels. Vitamin D's main role in the body is to help the intestine in absorbing calcium and helping to promote bone growth. But it turns out that vitamin D may help our bodies with more than just that. Results from a new Korean study show that vitamin D could also help reduce the risk of diabetes, metabolic syndrome, and fatty liver disease. After comparing the medical records of almost 200,000 people, researchers discovered that having high levels of vitamin D in the body were linked to a lower risk of insulin resistance, metabolic syndrome, and fatty liver disease in both men and women. All the more reason to make sure that your vitamin D levels are normal. It turns out Mom was right when she said eat your fruits and vegetables. Fruits are packed with minerals and vitamins, which is great for our health, but they also contain flavonoids, a group of plant metabolites that offer us health benefits through their antioxidant, anti-inflammatory, and antiviral effects. It turns out that flavonoids can help prevent heart disease in both men and women. A new study published in the American Journal of Clinical Nutrition has shown that increasing your consumption of flavonoids, which can be found in citrus and red and blue fruits, can help decrease the risk of heart attacks and stroke. So as much as you might not want to admit it, Mom was right. Make sure you are getting enough fruits daily. The American Heart Association recommends 4 servings of fruits every day. Those suffering from diabetes, which is now over 400 million people worldwide, have to constantly monitor their diet and blood sugar levels on a daily basis. Poor management of blood sugar can have serious impacts on long-term health, leading to complications like heart and kidney disease, vision problems, and even nerve damage. The current method of monitoring blood sugar has some drawbacks. It requires diabetics to self-monitor and to also attend occasional consultations with their physicians. Patients also fail to adhere to medical prescriptions, and clinician feedback is also infrequent. A new study shows that using a telemonitoring system to monitor blood sugar could help with proper blood sugar control. By using blood pressure, blood sugar, and weight monitors, all equipped with Bluetooth technology, diabetics are able to send their readings to research nurses who contact patients and recommend treatment changes if their blood sugar levels get too high. This way, patients will significantly decrease their blood sugar and blood pressure levels, and they're much better able to manage their blood sugar. A preterm birth is complicated for more than just occurring weeks before a child is expected. Premature babies, also known as preemies, are at a greater risk of death within the first year of life and are more likely to have chronic health issues. There are a number of factors that can increase the risk of having a preemie, like history of abortions, low maternal BMI, even being single can all increase this risk. A surprising factor increasing premature birth has recently been discovered following a 6-year study. A Chinese research group has discovered that temperature can impact the risk of a preterm birth. Following over 1 million births, researchers discovered that lower temperatures were associated with an increased risk of preterm birth, and higher temperatures actually had a protective effect. Temperatures between 9 and 12 degrees were linked to the highest risk of preterm birth. Hemophilia is a rare hereditary disorder where blood takes longer than normal to clot. An increased blood clotting time isn't that serious for something like a small paper cut, but it can be life-threatening to a person with hemophilia if they experience internal bleeding at joints or in vital organs. The BeHero-S study examined the challenges that U.S. adults and children with hemophilia face on a daily basis, and it turns out Americans with hemophilia experience negative psychosocial challenges. A shocking 98% of all adults with hemophilia reported that their disorder had negatively impacted recreational activities. The disorder also had a similar impact on 90% of children. Hemophilia was shown to negatively impact school and work by making it difficult to concentrate. So it seems that hemophilia may pose more of a daily challenge than previously thought. So researchers say the focus should now be on finding ways to lower the everyday struggles that those with hemophilia face. That's it for today. Thank you for joining the Medical News Bulletin. We hope you enjoyed hearing about the latest health news.